Good morning and thank you for joining us on Thriving on the Suncoast. We're finally getting some of that beautiful Florida weather. Alzheimer's disease is an irreversible, progressive, and debilitating brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out even the simplest tasks. In most people, symptoms first appear in their mid-60s. It's estimated that more than 5.5 million Americans may have Alzheimer's. Alzheimer's disease is currently ranked as the 6th leading cause of death, but some researchers have found that the numbers are much higher due to many individuals not being diagnosed. Alzheimer's is the most common cause of dementia among older adults. Dementia is the loss of cognitive functioning, thinking, remembering, and reasoning, and behavioral abilities to such an extent that it interferes with the person's daily life and activities. Dementia ranges in severity from the mildest stage, to where we begin to notice a slight cognitive decline, to the most severe stage, when the person must depend completely on others for basic activities of daily living. Assisting with a loved one with dementia is really a challenging job. It takes knowledge, understanding, compassion, and a great deal of patience. Support from family, friends, home care agencies, and community organizations is critical to the caregiver's health. The task 24/7 can be overwhelming, and the importance of getting good advice from experienced experts should not be understated. Caregivers often face unique situations daily, so getting advice from someone who's been there will make life a whole lot easier. And I'm proud to say that I've just received my Certified Dementia Practitioner designation. But I view this training as a stepping stone to greater understanding of this very complicated disease. One organization that's made a huge impact in communities all over the country is the Alzheimer's Association. Here with us today is Erin Killian. She is the program specialist with the local Florida Gulf Coast chapter. Erin, welcome to the show.
Good morning. Well, thank you.
So, Erin, tell us a little bit about the Alzheimer's Association in general, the scope of the organization.
Well, the Alzheimer's Association is actually a national organization, so we have offices throughout the entire United States, but I myself am part of the Florida Gulf Coast chapter. We actually cover 17 counties throughout the state of Florida, so we cover quite a bit of territory, throughout the state of Florida. We cover from the Citrus, Sumter area all the way down to Lee and Collier over to Polk County as well.
Are there some statistics about a presumed number of patients with Alzheimer's just in our local area?
Actually, within Sarasota County, that number is around 18, actually closer to 19,000 individuals, and that is estimated cases of Alzheimer's disease, and that does not include our seasonal residents. So that number, of course, does increase as we see those residents kind of come back into town, which is happening as we probably speak. End of October, we start to see kind of an increase in those numbers.
So obviously that's a very complicated process, very, very difficult, depending on the level of dementia for patients and their caregivers. The Alzheimer's Association has a vast amount of services that you provide. Can you kind of give us start at one end maybe and kind of go through some of those services?
Absolutely. I would say probably our most important service that we do offer is our 24/7 helpline. That is available 24 hours a day, 7 days a week, 365 days a year. There is somebody physically answering that telephone. It's not a teleprompt, it's not an automated service or anything to that nature. So that is something that families can utilize, because we know, unfortunately, with this disease process, troubles aren't happening Monday through Friday, 9 to 5.
Right.
They're happening at Saturday or Sunday at 2 o'clock in the morning. And so we need the ability to give them a resource to talk to somebody, to vent, to get resources as to how to manage that certain situation that they're going through. So that's probably our most important service that we offer. We, of course, have support groups all throughout Sarasota County, as well as Manatee County, Charlotte County, all over the place. We also have care consultations, so it's kind of a one-on-one meeting with whether it's just the caregiver or the entire family. And we're able to kind of really give them ideas on how to handle certain situations. Typically, we're talking about a lot of different situations during a care consultation, but we're able to give them resources, information, referrals, make referrals to community agencies that can kind of help them with what it is that they're struggling with at the time. We do have some safety services, so Medical Alert Safe Return is a big program that we offer. That program in particular, we encourage the caregiver as well as the person with the disease to wear. It's like any other medical alert bracelet you would wear if you were allergic to penicillin or anything to that nature.
Because if something happens to the caregiver and they end up in the hospital, then somebody needs to know they've got somebody at home that needs help.
Correct. You know, accidents happen. You know, you could be just grocery shopping and you have a slip and fall.
Yeah.
And so we need to know that there is somebody at home that needs the care, which leads me into our emergency respite services. So we do have a small piece of funding that we do have for emergency type situations where we are able to, whether it's put somebody into the home, like a home care agency like yourself, or place their loved one into a facility for several days, but we're able to get that person the care that they need in the meantime. So if something did happen to that caregiver, say they wound up in the hospital,
right.
If family was nearby and they needed a couple of hours, then a home care agency would suffice. But if they needed, say, several days because all of their family members lived out of state, then that's another area where we would most likely place the person with the disease until the family was able to get back into town.
If somebody's just starting to notice a lot of problems with a loved one, I mean, what should somebody who's not been diagnosed yet do?
First step, one of our other services that we provide is we do have some memory screenings available. I do them at the Senior Friendship Center in both Venice and Sarasota. So the Senior Friendship Center in Venice is the first Wednesday of every month, and the Senior Friendship Center in Sarasota is the second Wednesday of every month. They can call and make an appointment with us. But what that is it's just kind of a verbal/written exam. It kind of just lets us know if we're within a normal range or if we're falling outside of that.
We have to go to break right now. Stay with us. We'll come back and find out a little bit more how Alzheimer's Association can help you.
Is Mom really taking her medications?
A Comfort Keeper can ensure that your loved one gets their medications on time, providing peace of mind for families in need of flexible in-home care. Comfort Keepers, let our family take care of yours.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
I enjoy my active senior life, so feeling good and staying fit is important to me, but I wasn't comfortable joining a gym.
So my friends insisted that I would like physical fitness. A healthcare professional analyzed my body needs and developed a fitness program exclusively for me.
Join this week and your initial fee is waived. That's a savings of $99.
Love your life even more.
Call Physical Fitness today for your personalized medically based fitness program.
I'm Rob Wyatt, and I've been offering reverse mortgages in the state of Florida for over 21 years. If you are 62 or older, a reverse mortgage can allow you to access your home equity while staying in the comforts of your own home with no repayment obligations for the rest of your life. And you remain on title. Call us to learn how a reverse mortgage can provide you additional tax-free income to enjoy life now and create a peace of mind retirement for your future.
Comfort Keepers can provide a variety of in-home services for your aging loved ones. We'll assess their needs and create a custom care plan that can change as their needs change.
Comfort Keepers, keeping the comfort of home.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
Welcome back. I'm here with Erin Killian, program specialist for the local Alzheimer's Association. We were talking about if people are noticing a problem at home, or how do they get started into the system, and you were elaborating on that. Can you pick up on that?
Yes. So again, the memory screenings that we do provide, like I said, it's a written/verbal test. Takes about 20 minutes, but again, it's identifying if there is a issue or if they're falling within a normal range. We always encourage the participants of our memory screenings to follow up with their physicians.
Excuse me 1 second. When they do that, it's confidential. It
is,
doesn't go to
correct.
anybody else, doctors.
Yeah, nope.
It's just informational for them.
Correct. We do encourage, they are given their results after the test.
Yeah.
And we do encourage that those results go to their physician, because what that's doing is it's creating a baseline.
Right.
So we know where this person has started.
Right.
You know, we can kind of track their progress as they age. You know, there's people in their 50s and 60s that are getting memory screenings done because they've had that family history, so on and so forth.
And if you've noticed a problem, I mean, the doctor should be maybe ruling out, you know, other issues.
Exactly, and that's kind of that next process. You know, once that physician is aware that you're concerned about memory, those types of different things, they're going to start ruling out other kind of what we call reversible causes of dementia, which can be as simple as vitamin deficiencies, medication interactions, maybe sometimes depression or stress.
Yeah.
So those are all things that they can kind of help rule out, so we can figure out what is maybe causing some of those memory changes.
So if somebody's noticing a problem, somebody, you know, does your testing, they're seeing little issues, are you able to give them some advice about lifestyle things that they can do to maybe improve the situation?
Absolutely. So we have, you know, kind of through research and those types of different things, established 4 main areas where individuals can kind of help their cognition. There's no way to prevent Alzheimer's disease, but there are ways that we can kind of help with our cognition. Even individuals that have a diagnosis, these 4 things help them.
Sure.
So those 4 things, of course, are eating right. We kind of promote a Mediterranean type diet, you know, green leafy vegetables, lots of fruit, lean meats and proteins. Exercise, so we kind of follow the heart guidelines on how much exercise you should be receiving. Staying socially active, so kind of making sure that we keep our social circles large, and able to get out of the house and experience new and different things. That alone can be a huge benefit.
Socialization.
Yeah. Absolutely. And then of course, cognitive activity. You know, of course, the Sudoku puzzles and the crossword puzzles are great, but if we're so good at them that we can do them in pen or pencil, you know, then maybe we should try something different to just stimulate our brains a little bit more.
It seems like what's good, you know, you mentioned a lot of things that we've talked about here on the show regarding that had help your heart. So I'm helping your heart, helping your brain, helping your whole body.
Absolutely.
Yeah.
You know, that blood flow goes up to our brains, and we need our blood flow to be oxygen rich and good.
Tell us a little bit about when people get to that breaking point, what they should do when, you know, with frustration.
Yeah, in terms of getting a diagnosis, or
no, in terms of how they can get help, or how the importance of getting the caregiver some of relief.
So what we know is that over half the time the caregiver will pass away before the person with the disease.
Wow.
So a lot of what we do.
That's a big statistic.
It is, it is. And a part of what we do is making sure that our caregivers do stay healthy, that they are getting the help that they need via our support groups, or even as simple as our caregiver trainings. You know, knowledge is power.
You kind of glossed over support groups, but I can't emphasize enough how important that is for people to be around other people dealing with the same issues and learning from people that have been through it and people sharing ideas. I mean, there's nothing like it.
Absolutely. I mean, I probably learned more about this disease process by attending some support groups than I have in education or anything to that nature. You know, it's the people that are right there.
I've always heard you've met one Alzheimer's patient, met one Alzheimer's patient.
Absolutely.
Because there's so many different facets to how this manifests itself.
Yes, you know, it's so different from one person to the next. You know, you can have 3 people in the same room. You know, I do an early stage program down in Venice where it's the person with the disease and their care partner. And, you know, even within that same room, you have different people that are progressing differently, that are in different stages, even if it is just early stage, but you have different deficits and difficulties.
Did you find that a lot of people really don't take advantage of these things and wait till it's past the breaking point versus getting the knowledge in advance and understanding how it's going to progress and how
Absolutely.
to set their lives up for that.
Absolutely. This disease process takes an army, and so if we can kind of help you start building your care team and your resources in the very earliest stages, it allows you to better handle what's going to come in the future. It does take a lot of people. It takes, whether it's home care agencies or whoever it is, it takes a lot of resources. It's not something that can be done alone. And so when we see individuals reach out earlier, reach out for services, reach out for education, support groups, whatever it might be, they actually are more prepared, and they kind of help reduce that statistics of the caregiver passing away before the person with the disease.
Yeah, it seems to me that people wait to the last minute. They think they can do it all themselves, and nobody can give care like they do. And I think they're pleasantly surprised. I always tell someone that if they're not letting their batteries recharge and giving a complete mental break from caregiving, they can't be as good of a caregiver.
Absolutely, and it's going to affect their caregiving skills. One of the things that we talk about even within our communication presentation that we do is making sure that the caregiver is well rested, because that's going to affect how you are able to manage their challenging or difficult behaviors and how you are better able to communicate with them. If you're tired and exhausted because you've been up all night because your loved one's been up, and you're trying to keep it together because you still got grocery shopping to do and laundry and all of these other things, it's going to affect how you respond to that person with the disease.
Right.
And a lot of times it's not in a good way,
And, understanding how that person communicates and, not being reactive and trying to really understand what they really need is sometimes difficult.
Absolutely. And so if we know that if the caregiver is able to stay as kind of calm, cool, and collected through that difficult conversation piece, the better they're going to have in terms of outcomes.
Right.
So it's really up to the caregiver to change how they communicate versus depending on the person with the disease to change who they are.
We have to go to break right now. Stay with us. When we get back, we'll talk about some interesting events coming up you'll want to know about.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
With the help of Comfort Keepers, I'm keeping my mom healthy.
I'm keeping Dad on schedule.
I'm keeping my mom happy.
Comfort Keepers in-home professional caregivers can provide meal planning and preparation, health and wellness services, and personal care services through custom care plans that can change as needs change, so your aging loved ones can stay happy and healthy in their own home.
Comfort Keepers, keeping the comfort of home.
I'm Rob Wyatt, and I've been offering reverse mortgages in the state of Florida for over 21 years. If you are 62 or older, a reverse mortgage can allow you to access your home equity while staying in the comforts of your own home with no repayment obligations for the rest of your life. And you remain on title. Call us to learn how a reverse mortgage can provide you additional tax-free income to enjoy life now and create a peace of mind retirement for your future.
I enjoy my active senior life, so feeling good and staying fit is important to me, but I wasn't comfortable joining a gym.
So my friends insisted that I would like physical fitness. A healthcare professional analyzed my body needs and developed a fitness program exclusively for me.
Join this week and your initial fee is waived. That's a savings of $99.
Love your life even more.
Call Physical Fitness today for your personalized medically based fitness program.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
Welcome back. I'm here with Erin Killian, Gulf Coast Specialist on the Gulf Coast chapter of the Alzheimer's Association. Talking about a lot of really important things. Great resource for people with loved ones with Alzheimer's, dementias. We've got some interesting events. Education is key with this problem. And the more information people have, you know, the better they're going to, happier they're going to be, frankly, and the happier their loved one's going to be and comfortable. People don't always have to be placed because they have Alzheimer's. They can live at home comfortably, up to a point, depending on the client's needs. So tell us about some of the events that you have to educate caregivers coming up.
Yeah, one of the biggest events that we have coming up, and I say we because it's a collective group of individuals that helps plan this event. Senior Friendship Center is involved, Jewish Family Children's Services, the libraries, Tidewell Hospice, the list goes on, but is our Community Caregiver Forum. It's actually the 16th annual. It's located at Sarasota Memorial Hospital in the auditorium. But it's going to be a great event. It's from 9:30 a.m. to, I believe, about 2:30 p.m.
That was November 4th?
November 4th, Friday, November 4th.
They have to register by Monday?
Yes. Registration is October 31st. That's the last day that you need to register by. And the reason for that is there is a complimentary lunch that SCAN helps us provide.
Sarasota County Aging Network, proud sponsors of this every year, providing the lunches so people can really encourage them to come. And do you offer some assistance with someone who has dementia for the caregiver to be able to get to the meeting?
Yes, we do. We offer some free respite services for individuals that do want to go to the forum and maybe have a loved one at home. There is an application, I should mention that, for the respite program. We do have to have the application, so therefore when we're sending the information off to the home care agencies, they know who it is that they're caring for. So there is an application process, so I would suggest they get that done as soon as possible.
And just like a loved one having knowledge on how to care for that person, you know, an agency that you might hire really needs to have the proper training and understanding and have their caregivers trained appropriately to be able to understand the disease process.
Yes, absolutely. That's one of the biggest things that we kind of educate families on, you know, is going with agencies that have the training and the knowledge and have the backing between whether it's liability insurance, workman, you know, they're licensed. You know, those are really things that are highly important to make sure that you're covered and you're safe and that your loved one is safe.
Well, we're proud to, you know, have Charlotte, my wife, who's a certified dementia practitioner and has trained under TIPA Snow, so disseminating that information to our staff. Tell us a little bit more about what people are going to learn and maybe some of the topics at the Caregiver Forum.
Yeah, some of the topics, I think one of my favorite that I'm most interested in hearing about is called Transitions in Healthcare. We're having a panel of individuals from Sarasota Memorial Hospital kind of talk about the different changes that have occurred. You know, especially with Medicare, you know, that difference between an admittance stay or an observation stay, and how that affects how things are going to be paid for, so on and so forth. So I'm really excited to hear that information and kind of learn a little bit more about that. We are going to have an elder law attorney. Actually, Ira Weisner is going to be our elder law attorney. He's going to be talking about, of course, all the documents needed to care for someone. And it's, you know, the Caregiver Forum isn't just for individuals that are caring for somebody with Alzheimer's disease or another form of dementia. It can be any caregiver, you know, whether it's mental illness or physical disabilities, so on and so forth. Absolutely. So all of those financial documents that are needed. And then, of course, we have Miriam Lasher, who is actually on the planning committee as well.
Wonderful.
She's going to be talking about resiliency into tomorrow. So kind of being a resilient caregiver and kind of what that means and what that looks like and how to be that resilient caregiver.
You know, you mentioned paying for things and so forth, and people do need to also understand long-term care. Usually a dementia is a triggering event for getting long-term care, home care paid for. So it's an area that, you know, an agency has to be knowledgeable about helping somebody collect on their benefits.
Absolutely.
Yeah. So that Caregiver Forum's a great day of information and camaraderie and great community resources.
It really is.
How else can people get involved with the Alzheimer's Association to support your work?
Yeah, absolutely. One of our largest ways to get involved with the Alzheimer's Association is, of course, our Walk to End Alzheimer's, which this year is, of course, November 12th at Nathan Benderson Park.
That's going to be a fun venue.
It really will be. You know, we kind of outgrew our last venue, which is a great thing. We're very excited about that. But it allows us to kind of grow and change and kind of add more people, raise more money, all of those types of good things. All of the money that is raised from the walk goes to different things. So 78% comes back to the community to support the programs and services that I talked about earlier. All of our programs and services, besides the Medical Alert Safe Return, is of zero cost to the families. So of course that's how we are able to support our programs and services within the community. And then also we're able to just, as much as it can be somewhat of a, you know, I hate to say depressing event, but you know, we're there to support a disease process that is yet to have a cure and yet to have a medication regime that is truly effective. And so it kind of gives us a little bit of hope for the future because some of those funds do go towards Alzheimer's research and such as well.
The event is really, every year you guys do an amazing job and the team puts together an exciting event, and it's great camaraderie and it's actually very high energy.
It really is,
yeah.
You know, for the disease process at hand, it definitely, we try to keep it as high energy as possible. You know, it really is kind of sometimes a very fun event.
I think my daughter won a prize for the youngest walker at the event one year. We've been doing this for a lot of years,
Yep.
and there's still a great need for it. And you know, come out to the walk. What's the date on that?
Yeah, November 12th. Registration starts at 8. Walk kickoff is at 9. And again, you don't have to be pre-registered. You're not required to raise any funds.
Right.
But you know, we of course would love to see that happen.
Yeah.
But you can create a team.
It's
you can get
amazing if
friends
you ask
together.
a friend or neighbor, they've been touched by Alzheimer's, they're more than happy to help. We'll be there walking. If you don't have anybody to walk with, come walk with the Comfort Keepers team.
Absolutely.
Erin, this has been very helpful, and thanks for all you do. Hopefully you have a great, successful walk. If you need help at home, call Comfort Keepers, and we'll send a trained caregiver out to assist you with a loved one with dementia issues. Thanks for watching. We'll see you again next week on Thriving on the Suncoast.
Comfort Keepers, Comfort Keepers, 'cause there's no place quite like home. Call Comfort Keepers.